Our Let Joe Know team has been getting refunds for people billed for those COVID-19 vaccines. All new for you this morning, Joe Ducey is hearing from others stuck paying new patient and office visit fees for COVID tests.
As more people get COVID vaccines, some are still fighting bills they received months ago for COVID tests.
The amount that they're saying is due is $127.
Tammy Delgado says that's how much Banner Health is billing her daughter for a drive-through COVID test last year.
I said that I thought they were free.
When I originally registered on there, it said like free COVID testing.
Catherine Welch says she got a drive-up COVID test through Embry Women's Health in January.
I didn't expect to get anything until I got this in the mail.
It's a bill for $82.90. Just like COVID vaccines, COVID tests should also be free to anyone. Providers get paid by the insurer or the government. People we hear from are not getting charged for the test, but for the process.
If they come in and they say, you've never been to this office before, we're just going to run through some things, that should send off a warning bell.
Caitlin Donovan is with the nonprofit National Patient Advocate Foundation and says some providers are charging creative fees. We asked her to look at these bills.
They were charging for a new patient visit instead of just for testing, was a concern to me.
That's Catherine's bill. Embry Women's Health charging $82 for a new patient office visit.
All I did was go through a drive-through COVID test.
We took that to Embry Women's Health, and they agree, saying the bill was a mistake sent out by a vendor. They say Catherine nor anyone else owes them for any COVID test-related charges. As for Tammy,
At that time, I was told they were paying for the nurse.
but her daughter's $127 bill from Banner Health shows an office outpatient charge. Banner Health says they can't comment specifically for privacy reasons, but say they bill insurance companies for the cost of administering COVID tests, saying it's up to the insurer if they cover the costs. So protect yourself.
Call the office ahead of time and say, I'm looking for a COVID test. What would my out-of-pocket cost be?
If you're charged, contest it with your insurer. And Caitlin says, wait to pay a medical bill.
Half of the bills we see have mistakes in them.
Embry Women's Health says they only charge for the rapid COVID test, and that's paid on site. If anybody else received a COVID test-related bill, you need to get in touch with them. And the National Patient Advocate Foundation has funds set up to help with COVID costs. Go to abc15.com/letjoeknow to see if you qualify. I'm investigator Joe Ducey. You got a problem? Let me know.